Good morning, and welcome to Issues That Matter. And I want to start off by apologizing. I've been errant and not been on, we haven't broadcast new shows for the past few weeks. And for those people that missed the show, which hopefully there are some, I want to apologize. And for those people that did not miss the show, I guess I could apologize for having a show. But in any event, we have a good show lined up for today. And before I start talking about that, I want to talk about the show that we have lined up for next week and later on in June. Next week, we have Dr. Aaron Weiss from the Maine Children's Cancer Program to talk about bone marrow transplants and the need for people to volunteer to get tested to see if they are a qualified candidate for bone marrow to be a donor. There's a great necessity out there, the great need on the part of the children who have cancer for the transplant. And then come June, we're going to have Commissioner Mary Mayu of the Maine Department of Health and Human Services again. And she's going to be giving us an update as far as what's on their radar screen, what their goals are, where they're going. But today, we have Mr. Terry Kungel, who is the chairman of the board of the Maine Coalition to Fight Prostate Cancer. Terry, welcome.
Thank you. Well, on behalf of the board of directors, our volunteers, and all our members, thank you for having us.
Well, it's our pleasure. It's our pleasure. Being a male, you know, it's obviously something that I'll say mildly concerned about for my own personal, but having some very, very scant knowledge of it, I can see where it's a major concern for society in general. And where do we stand in the state of Maine relative to prostate cancer?
Unfortunately, in Maine, we have both higher incidence and higher mortality. Every January 1st, we know there's going to be 1,400 new men get diagnosed or more. And every year, we're losing approximately 200 men. So with the death rate that we have with prostate cancer, it really is an issue that matters.
Well, thank you for getting the name of the show in there. I appreciate that. So the mortality rate is?
You've got to do it in terms of the number per 100,000.
Yep.
And our number today is roughly about 23, 24. But that's we essentially have about 650,000 men in Maine. And that's how you get to the 1,400 number and the roughly 200 that are dying every year.
Now, how do you get involved with the leadership position that you're in?
Well, unfortunately, prostate cancer came into my life when I was 16. My paternal grandfather was diagnosed with metastatic prostate cancer. And that was an era when we didn't have any testing. And approximately 80% of the men, when they first presented to their physician, had an incurable cancer that had gotten so far along. So we now do have testing, and we have a much better outcome if people are getting tested. But so I lost my grandfather. I was a pallbearer at 17. I subsequently lost my dad to prostate cancer. And I was diagnosed with a stage T2C prostate cancer in 2007, had surgery in 2008. So that was sort of the personal experience. And one of the things that I saw when I was going through this process, you have all kinds of questions, and I found a number of guys that, you know, were willing to talk about stuff you don't necessarily want to talk about, that were enormously helpful. And I basically sort of said, you know, when I sort of got through that process, how do you sort of pay back? And the answer was you can't pay it back, but you can pay it forward. So what we're all doing here in Maine, and we're all a volunteer organization, is we're a band of brothers trying to make the guys that are newly diagnosed have an easier path than sort of what we all went through, and try to, you know, answer more of the questions, help provide a little bit more guidance in terms of what's important to them. And so it's a process where, you know, there really is this band of brothers trying to help.
Well, as we chatted earlier, there's a lot of very, very good causes out there. And again, living in Kennebunk, Hardly a weekend goes by when it's the nice weather time of year. Hardly a weekend goes by where there isn't a walk, a bike event, a golf event, some type of fundraising event for a good, worthwhile cause. And one of the things that I've spoken about on the show in past weeks is the importance of being involved, the importance of being an advocate for your cause, and how it's a win-win. It helps you test yourself to see what you're capable of doing. It keeps you involved, keeps you motivated, and in the process, you're helping not only yourself, but you're helping a lot of other people. And if everybody were to do that, I think the world would be a little bit of a better place.
No question about it. And I can't sort of echo what you just said more than the guys that get proactive and take charge and try to sort of manage this process have much, much better outcomes. And we had a process where we were trying to go around to the different network groups. And historically, we've done, I think, a good job of basically helping guys sort of navigate this medical journey. But we also started to recognize there's this emotional journey with cancer as well. And we essentially went around the state to all 8 groups twice. And what we found were there were certain patterns for success and certain patterns for failure. The people that were resilient, the people that sort of had some hope, not Pollyannish hope, but real hope, and who were proactive tended to have much, much better outcomes. If you're not, if you're passive, you're hopeless, and you're not engaged, you've got a dramatically worse outcome. No question about it.
Why do you think that might be?
Well, to a certain extent, you're in a place where you've got self-fulfilling prophecies. If you think it's going to work, it will. And if you think it won't, it won't. And that really gets to the issue of sort of hope. There was a book by Jerome Groopman, The Anatomy of Hope. Here's an MD that has a disease himself, starts to sort of get a much better perspective on sort of the patient perspective. And what you saw happening was that the patients that were proactive and sort of said, okay, I know I'm up against a tough fight, but I'm going to do something, I'm going to do whatever I can. That's a much, much better likelihood for a positive outcome. Even, quote, if you sort of lose at the end, you've got a much better quality of life through that whole process.
I want to tag on to your quality of life. I can say from personal experience, the quality of my life has been greatly enhanced through my involvement in the advocacy aspect of the challenge. And I totally agree with you that the positive outlook is critical. And the mind, I often say, and I say this with my grandson quite a bit, where the mind goes, the body will follow. And when I'm playing baseball with him, I say, where the eyes go, the bat will follow.
Yeah.
The mind is a remarkably powerful mechanism that we're born with.
No question.
Where do you see the future going? What challenges are you facing in Maine?
Well, the sort of 2 biggest challenges we have are guys that say, I'm feeling fine, I don't need to do anything. And when you have diseases that are asymptomatic, meaning there's no symptoms, you can get into trouble pretty quickly. So we definitely encourage guys to be proactive about their health. And we also encourage Dr. Mom to help the guy sort of make the right choices, because Dr. Moms are sometimes more important than the guys. The second thing I would say is that we've got, that's a big problem, is too frequently you see a guy get a diagnosis and then he's immediately making a fear-based decision. He's out the door, doesn't really care what it is, has to do something immediately. And most of the time, prostate cancer is a fairly slow growing, so we definitely encourage guys to sort of do their homework, do not make a fear-based decision, and really understand sort of what the options are. And unfortunately, in prostate cancer, not only do you get told you have cancer, you're then told there are these 15 options out there, and you have to go figure out what to do. I mean, there's like 3 different forms of surgery. There's like 6 or 7 different forms of radiation. we've got brachytherapy, we've got cryotherapy, we have folks that are now even trying to do, sort of lumpectomies with the prostate. So it can get pretty confusing pretty quickly.
I can see that. In addition, there's, I guess, Don Imus, the host of Imus in the Morning.
Everybody knows Imus in the Morning.
Yes. Well, he has prostate cancer.
Okay.
And I guess his wife is treating him through diet and vitamin supplements and stuff. And I guess he's doing all right. I don't very often listen to him anymore.
Well, we got to be careful here, which is some of these folks that get into supplements and the like, and sort of this is the Steve Jobs, macrobiotic high. You can manage the PSA. That doesn't necessarily mean you're addressing the cancer.
What does PSA? What does that?
Well, PSA it's a marker. The technical term is prostate-specific antigen, and the antigen is what we're measuring. PSA can also stand for prostate-specific anxiety for some number of guys. What PSA does, and there's really two methods for detecting cancer. Generally at your annual physical. One is a blood draw where you're getting the blood test to see if there's a PSA and what measure it is, what level. And the other is a digital rectal exam to see if there's a detectable nodule.
Okay. Now, the metastatic.
Metastatic, the normal progression with prostate cancer is that it's an indolent form, it's not aggressive. If you look at autopsies of 60-year-olds, you'll generally find 60% have prostate cancer. If you do autopsies of 70-year-olds that died from some other cause, 70% of them have prostate cancer, 80% of 80-year-olds. So the overwhelming form of prostate cancer is indolent. So this is not something, this is something guys absolutely need to be proactive and do something about. But they do have time to make some decisions, and if it's treated early, they can have much better outcome. If it's ignored and they don't do anything or they're not getting any testing, what can happen is what happened to my grandfather, which is it gets outside the prostate gland, it travels to the bones, and then you have an incurable disease. And that's what metastatic is, it's an incurable disease.
Okay. That's in the reading that I've done, and I can't say that I did a lot of reading, but in the reading that I've done, I could not get a clear definition of what metastatic was. It was a commonly used
It's essentially, it's the cancer migrating from the prostate out to and you've got migration to bones primarily, but you can also have it going, you can have visceral.
I should have been able to put the links together because I do have a clue as to what metastasized means.
Yeah.
And I never drew that correlation. Never drew that correlation. Thank you for educating me on that. Okay. What role do you feel a person's network of people play? Friends, relatives?
Let me answer that sort of two different ways. The caregiver in this whole process is absolutely enormously important. And one of the things that we say is that the guy doesn't get prostate cancer, the couple gets prostate cancer. So one of the things that we try to do with all of our network groups is include the caregivers as well, because they're critical to this whole process. And when my wife and I were going through my prostate cancer, we were always together sort of in the room, and there were multiple times we'd walk out of the room and go have a cup of coffee and find out we weren't in the same place because you're hearing different things. So having sort of that advocate with you through most of these meetings, I think is really important. The other thing I would say is when you go off and you just, some guys sort of man up and just, I'm going to tough this thing out. If you get in a network, you start to find out, hey, you're not the only one that has this. And you can share some stories, you can share what sort of works, and particularly when you get into advanced prostate cancer, there's all kinds of different side effects. The guys have started to figure out how to sort of manage those better. So being with a group in a network, sort of being able to get your questions answered and sort of hearing it firsthand, I think the doctors do a great job, but their time is really quite limited. So having a chance to connect with some other guys, the band of brothers that we are, I think really is important.
How many support groups do you have spread out across the state?
There's 8 groups. We work with the Beth C. Wright in Ellsworth, with the Alphon Center in Augusta, with the Dempsey Center in Lewiston, Cancer Community Center in South Portland, Mid-Coast Hospital in Brunswick, and all of these organizations really are enormously important for not only the prostate cancer community, but other cancers as well.
For those who live in the southern Maine area, like Biddeford, Kennebunk, Saco, and so forth, for those that have prostate cancer, what would the process be to start up a support group in an area?
This is a perfect question, because one of the things that we are trying to do right now is start a new group in Wyndham, because our goal would be to sort of have a place that's sort of within 30 minutes drive time, any place in the state.
Yep.
The problem that we have is we've got sort of the large standard metropolitan statistical areas, the big cities covered. Because of how diverse Maine is, and I think all the different patient groups have a really difficult time trying to reach the folks that are out, off the grid. And the folks that are off the grid tend also to be less connected to the internet, which makes them sort of doubly off the grid. So reaching those folks is tough. But one of the things we would love to see is anybody that's watching, we would love to have you help us set up a group in your area.
Yeah, the rural nature of the state, and Maine has been judged to be the most rural state in the country. And that certainly offers a challenge to groups such as yours, or the National Multiple Sclerosis Society, and various others. I mean, because people are so spread out.
Well, but one of the things that we are exploring is I was previously on a visiting committee at Dana-Farber. Dana-Farber had a big bus that they converted into a mobile van, and they would have a doc and a nurse that would be doing blood draws. And one of the thoughts, and I've had some conversations with Mark Kennedy, who's running the Massachusetts Prostate Coalition, the possibility of getting that bus up to Maine and going around to all these remote areas to figure out how to get these guys, screened.
Yep.
And that's one of the other things that we really try to do with all the hospitals, to the extent that we can, is for guys that are underinsured or not insured, try to get a screening to sort of help them through this process. And it's sad in some of these cases to see, I was at Bridgeton for a screening, and I was talking to a couple guys, and I sort of said, when was the last time you sort of had a physical? And the guy says, well, I was in the Army for 22 years, but I've been out of the Army for 23 years and have not had a single physical since then. So, we've got, because of the fact that Maine is one of the oldest age groups, and because of the economics of the state, we're getting doubly hit on prostate cancer, and essentially all the cancers.
How's the relationship between your organization and the state DHHS?
We try to work with them. I was the chairman of the board and CEO of the Maine Cancer Consortium, in addition to the Prostate Coalition, Maine Coalition to Fight Prostate Cancer. And they've got a lot of things on their plate. We would all, I think, love to see them doing more on the cancer front, especially prostate.
Let's see. Testing. There's been controversy surrounding the PSA test.
There's been controversy, yes.
Yes. Why don't you talk a little bit about that?
The U.S. Preventive Services Task Force, which is a governmental organization, has come out against testing for prostate cancer, breast cancer, cervical cancer. And previously, until 2 years ago, they've got to look at these tests and sort of say, do the benefits outweigh the risks? And the previous position that they had, which was defensible, was it was inconclusive. But this last iteration, they came up with a D recommendation that said, not only do we suggest you not do the testing, they want to stop the conversation between the patient and the doctor about what happens. So where they're trying to take us is back where my grandfather was in 1964, which is no testing, and we're going to see, 80%. And we know what happens when you don't do testing. 80% of the men in 1964 were presenting metastatic, incurable. To now say stop testing, which is what Choosing Wisely, the American Cancer Society, and USPSTF are all doing, is jeopardizing a huge number of lives, because unfortunately the guys that listen to this are going to get caught later in terms of when the prostate cancer does show up, and then we're going to be able to say, we're going to be able to do a lot less for you than if we had caught it earlier. So the place where I think the USPSTF, the U.S. Preventive Service Task Force, should have gone is to say, and we agree with this, when guys hear prostate cancer, going back to this, there's these fear-based decisions, they rush out and do something. The problem we have is 90% of the men, when they hear cancer, rush out to go do something. What we would like to see happen is more guys get engaged with active surveillance, which is a real protocol. What that is every quarter, every 6 months, you're doing tests to see what's going on, to see if there's progression. But there's a really important point here, which is if you're doing active surveillance, there is no quality of life issues. So to the extent that it appears to be a low-risk cancer, we really are encouraging guys to consider the active surveillance option. That's not watchful waiting. I mean, watchful waiting is sort of wait until it gets too late and then you can get your affairs in order. Active surveillance is a real protocol. It's real oversight. You're going in there on every 6 months or earlier 3 months to be able to make a determination of sort of what's going on.
So they looked at it and they determined that the cost outweighs the benefit.
Well, they essentially, with the D recommendation, is saying we don't trust the doctor and the patient to make the correct decision, so we'll make that decision for them.
And when was this decision made?
This was 2 years ago. And what's happened is there's intermittent pieces of data here, but there was one fairly large group that looked at what happened once the USPSTF don't do testing came out, and they saw a 25% reduction in guys getting tested. Well, that 25% that says, well, I don't need to worry about this, are essentially playing Russian roulette.
And they're doing this with prostate cancer, and they're also doing it with breast cancer?
Well, the breast cancer group basically came back and they got them to sort of change their position a little bit. We guys haven't been nearly as effective about that.
Why might that be?
Well, Susan G. Komen, and I mean, the women are just much, much better organized on all this stuff. And it's tough to get some of the guys as engaged as you see the women on the breast cancer side.
Maybe the guys can get the women to kind of be their voice.
Well, actually, a lot of the partners in the Prostate Cancer Coalition have been enormously helpful and have played huge leadership roles in doing what we do. So it's really been a partnership of equals.
I mean, the skeptical part of me, and it tends to be an ever-growing piece of me these days, but the skeptical part of me says that they're reducing, that they either don't know what they're doing or they're just making the wrong decision. I mean, to get involved, to get between the patient and the doctor clearly is the wrong decision. To reduce communication between the patient and the doctor
Well, to say we don't trust you to make the right, we don't even trust you to have this conversation. And the thing that's, the piece that sort of, I think sort of so regrettable with what the U.S. Preventive Services Task Force did was they just did everything in the current piece of time. If they'd looked backwards, they would have seen, you know, my grandfather an 80% mortality rate because we didn't have any testing. The other thing that they didn't do was they didn't look forward. We now have, I just came back from the American Urological Association meeting in New Orleans. We now have 12 new tests that are substantially better than the PSA tests. So if they had been looking forward, I mean, you do not tell a whole group of guys, stop testing when there's this whole new proliferation of better tests. The other thing that we have, or that's going to be coming out increasingly, is MRI-guided fusion transrectal ultrasound biopsies. And what that means is today we're basically sort of taking samples from sort of a grid that came out of the oil industry. The new process, something we all hope to be the new standard of care, is you're actually taking core samples from the suspicious areas, and then you have much better reliability in terms of the Gleason score, which is a measure of sort of how aggressive your cancer appears to be.
I'm going to approach I would say, semi-controversial area, which I try not to do on the show, but the Affordable Care Act. Where do you see, or how do you see the Affordable Care Act impacting what the mission is?
Well, there's provisions in there for sort of preventive treatments, but I would sort of say what we're looking at from the data that we're seeing is declining rates of testing, even though you've got the Affordable Care sort of saying we're going to try to help on that. So the bottom line is there doesn't appear for the prostate cancer community, specifically for prostate cancer. I mean, anybody that is being helped by Affordable Care Act is benefiting, but specifically to prostate cancer, hard for me to sort of see where there's a direct benefit.
And do you see any link between the position that they took 2 years ago relative to testing and relative to not supporting communication between the doctor and the patient? Now, that was done 2 years ago, which kind of in the same time frame as the Affordable Care Act passing.
I think there were two separate independent events. I mean, the U.S. Preventive Service Task Force continues to look at a number of these different diseases. The thing that I would sort of say about the U.S. Preventive Service Task Force is there was a woman pediatrician in charge of this review panel. Imagine what the breast cancer community would do with a male pediatrician on a breast cancer. We did not have, one of the things the U.S. Preventive Service Task Force takes a position of is anybody who's knowledgeable is, quote, biased, so we have to have a panel of people that are not urologists, that are not, prostate cancer oncologists. Easy to get to a wrong conclusion.
I can see some issues with that.
Well, the thing was, I mean, they had the data to say, let's address overtreatment. I think anybody that's sort of in this area sort of says, gee, that's a huge problem. But, guys in Maine are, I think, sort of smarter than the USPSTF. When the oil light comes on, they pull over and put some oil in. They don't stop driving the truck. The U.S. Preventive Service Task Force basically said, well, because there's issues, we stop everything. And that is putting, hundreds of thousands of men at risk of dying prematurely from prostate cancer.
That would, in my mind, which is not always logical, but that would defy logic. Gee. Interesting.
Well, I mean, the thing is that we are going to be looking at thousands of men dying an avoidable death because of the U.S. Preventive Services Task Force.
Now, what areas, and you may have touched on this earlier, but what areas do you see opportunities for people to become proactive?
Well, we would love to, I mean, because we're all volunteer and we're operating with quite limited dollars, we would love to have more people come forward. We'd like to have more groups, more network groups across the state. One of the things that I think would be terrific is if we could have different fraternal organizations decide that within each of their organizations, Knights of Columbus, Lions, that they were going to form a group so that sort of brother could help brother, so that when somebody does get diagnosed, and unfortunately the fraternal organizations sort of have the same age group where this is an exposure, we'd love to see more of the fraternal organizations step up and say, this is something that we should do to help our members. But we would love to have more network groups. You know, we can use all kinds of assistance on the web page. I mean, there's a whole host of things where we would love to have some volunteers step up and say, what can I do to help?
One of the thoughts running through my mind right now is, you know, they've come out and they're trying to restrict the communication between the doctor and the patient relative to prostate cancer. Well, I've already talked about my skeptical side. Now I'm going to talk about my rebellious side. Well, I'm a rebel. I don't want, while I am not one who very quickly runs to the doctor. In fact, I would probably fall way on the other side of the scale. That said, I do believe that the rebellious part of me says, well, if they want me to communicate less with my doctor, I'm going to communicate more.
Well, I mean, in some cases, I mean, I would say you've got to be comfortable with who you're working with.
Yep.
And if you have a doctor that's not responsive, that you know is not listening, you know, prostate cancer and a number of the cancers are what they call preference-based, meaning that there is not a perfect solution. So you've got to be able to have a conversation with somebody you have some trust and who listens. Listening is important. So, you know, particularly if you've got a primary care physician that's saying, do not do, you know, any testing for prostate cancer, our suggestion would be, you know, you may want to review who you're working with because they're putting you at unnecessary risk. And we're not saying, you know, all testing for all men all the time, but, you know, if you are healthy enough to have radiation or surgery, if you've got a life expectancy past 10 years, if you don't have, you know, serious other comorbidities that would prevent you from like doing surgery, you know, we think it would make some sense for you to have a conversation with your doctor, but, you know, why fly blind? Why not get the data to sort of know where you are?
Okay. If you had one takeaway that you want to have from this show, things that we talked about on the show today, one or two takeaway items, things that you most want people to understand.
I think
what might they be?
I mean, if I was talking to the guys, it'd really be two messages. One is get proactive, take some ownership about your health, not just prostate cancer, but all of your health. And secondly, you know, make sure that you're behaving. I mean, if you look at it's not just prostate cancer, it's sort of what do you need to do to be healthy. That means stop smoking, exercise, reduce the calories, get rid of the salt, fat, and sugar. You know, there's a lot of things here that you can do that can really improve outcomes.
Yep. Well, I'm going to give you an open invitation. Anytime you want to appear on this show, give me a call, send me an email, let me know. I would also, I know you've had conversation with Steve Poulos about having a show of your own. I would encourage you to do that. I can't tell you how much I've enjoyed having the opportunity to do this show.
Well, thank you. Thank you.
I think you'd make a great host. And I'd love to have you join the band of brothers.
Okay. Great.
Brothers and sisters who host shows on this TV channel, this cablecast channel. And they have a lot more shows these days than they had a year ago. and I'd love to have you added to it. Any parting words?
Well,
Before
the
we
thing
wrap
is
up?
that for the Maine Coalition to Fight Prostate Cancer, not only can you contact us by the website, but also we're available sort of all the time. Call 855-552-7200, extension 800, and you're just a phone call away. So.
Okay. Well, that's great, and I'm gonna give it one more peck. Get involved. Become an advocate. I can't speak highly enough of what it's done for me personally. It's opened up doors of opportunity that I would have never gone down that road. I would have never gone down the path to look for the doors. And in fact, I wasn't even looking for the doors of opportunity. The doors just happened to appear in front of me. Get involved, and great things can happen, not only for you, but for the organization that you're involved with, and for society in general. It helps you maintain a much more positive attitude, and having a positive attitude, always thinking about the positive outcomes, is a wonderful way to live. It's a happy way to live. It's a productive way to live, and it's a safe way to live. And the focal point of this show is simplify your lives, make them safe, make your life safe, but most of all, make your lives enjoyable. With that, I'll see you next week. I look forward to it. And again, next week, we're going to have Dr. Aaron Weiss. And have a great, productive, and safe week. Bye-bye.